Welcome to the Joy Doctor Show. This is your host, Dr. Michelle Richards. I come to you today with the hope to talk to you about anxiety. I have a question that was posed to me about anxiety. Let me find it. So the question comes from the concerned husband. It says, "Dear Dr. Joy, my wife has been diagnosed with generalized anxiety. I don't understand what she's going through. She says she feels fear, worry, and anxiety about a variety of things. But these terms, are they used interchangeably or are they different? How can I help my wife?" Signed, Concerned Husband. So the answer So let's answer these questions one at a time. Let's see if they're interchangeable or different. Dear concerned husband, your caring and concern for your wife comes through loud and clear, as does your desire to understand her experiences and support her. You're not alone. These terms are closely related and make even coexist, so that it makes it difficult to tease it apart. Let's untangle these terms. Fear. Fear is an innate biological response to an imminent, perceived, or real threat. This was designed for our safety and survival. Our senses perceive our information through our eyes, our ears, our nose, our skin, and taste buds. If there is a perceived or real danger, the body goes through a series of intricate biochemical processes resulting in the experience of fear. You may know this process as fight or flight. This is normal. For some, especially those with trauma, this early warning signal may malfunction and become a full-blown alarm and panic due to a faulty evaluation of the sensory data perceived. And the limbic system has a lot to do with this. On the other hand, worry is also a built-in biological process that entails sorting through your thoughts to identify the ideal solution. In this way, these thoughts are normal. Worry tends to be focused on the future. Anxiety, let's talk about anxiety. Anxiety focuses on a threat that may or may not occur. Anxiety is also a normal response to stress and worry. Anxiety symptoms occur on 3 levels: emotionally, where there are feelings of fear, sadness, and irritation. Second, physiologically, examples include elevated respiration, heartbeat, and discomfort in the chest and abdomen. Thirdly, cognitively, examples of that may be negative thoughts and worry about the future. Anxiety disorder, let's talk about that. Long-lasting worry and anxiety are problematic, while anxiety is also a normal response to stress and worry. Long-term, unchecked and untreated worry and anxiety, or both, may turn into one or more anxiety disorders. There's a cluster of anxiety disorders identified in the Diagnostic Statistical Manual, Edition 5. 1. Separation anxiety. 2. Selective mutism. 3. Specific phobia. 4. Social anxiety. 5. Panic disorder. 6. Agoraphobia. 7. General anxiety. So you asked about general anxiety, so we're going to turn to general anxiety now. General anxiety disorder is diagnosed when anxiety and worry are out of proportion to the dreaded, fearful event. Sometimes anxiety arises for no apparent reason. The anxious person has difficulty controlling being anxious or these symptoms. Anxiety tends to happen most of the time with these people, and it has been going on for a long time. The anxious person may have a few of the following symptoms: feeling on edge, keyed up, or restless. 2, easily tired. 3, poor concentration or blanking out. 4, irritability. 5, muscle tension. 6, difficulty sleeping. These symptoms must make it really hard for the individual to function in life. The symptom also to be diagnosed as disorder may not be explained by a different or medical condition, drug abuse, or some other reaction. It should not be underestimated how debilitating this disorder is. So you also asked, how can you support someone with anxiety disorder? Supporting someone with anxiety disorder, 1, don't minimize their experience. No anxious person, know that the anxious person can't get over it or just suck it up. 2, understand anxiety disorder. Read up on it. 3, be empathetic of the anxious person's plight. 4, encourage the sufferer to get professional help. In this case, therapists and psychiatrists may be retired. The therapist talk therapy and the psychiatrist does medication therapy to support the individual. If they're prescribed medication, encourage them to take that medication. 5, remind and help the suffering person to practice the coping skills that they learned in therapy while in the throes of anxiety. So that is my answer about the differences between anxiety, worry, anxiety disorder, and the like, and how you can help your wife to negotiate this successfully. This is the Joy Doctor, Dr. Michelle Richards, signing off. Come back next week where I will answer questions live. If you show up, I will answer them. Bye for now.